Thank you, David, for the introduction. I'm actually taping this on election day, so I don't know what's going to happen at the end of today. And so if you see some nervousness in my voice, that's what it is about. But thanks for inviting me to this meeting. It's a mystery how well Zoom is working, and I think it's going to be a boon to global health. The fact that we can get people from around the world sharing a time and a discussion that we could not have done before. A rocket scientist at NASA once said, "When I have no idea what I'm doing, I call it basic research. And if I have some understanding of what I'm doing, then I can call it applied research." What I'm going to do today is just a little bit of both, and you'll know what's basic research because you'll figure out when I don't know what I'm talking about. I'm going to jump around and hope the result looks planned and that things will come together at the end. The White House decision to take the United States out of WHO leaves us in a position where we really have to consider how do we strengthen our global approaches in new ways in the future. We're celebrating 40 years this year since WHO declared that the world was free of smallpox. And we're actually stopping to ask, what are the lessons that we've learned from this? What are the truisms? And how could these be applied in the future? I'll share some of that today, some of the conclusions that we've come to. But I would also suggest as you're looking forward at how to organize for the post-coronavirus period, that you look at Gavi and you look at the Mectizan program. Both of these are exceptional programs where they found a place between institutions. They become the mortar, actually, between institutions. And so they have a great deal of flexibility and freedom, but they can still rely on WHO and other institutions. So look at that. Also, don't forget how much has changed just in our lifetime. When I started medical school 63 years ago, I was already interested in global health, but found it very difficult to find anyone on the faculty that was interested in global health. I did find one person finally, Ray Ravenholt. He had been in the second EIS class at CDC, and he said to me, there aren't many pathways into global health. Everybody makes their own way. But I would suggest you go to Atlanta, try to become a member of the Epidemic Intelligence Service, and you'll find people there interested in global health, and they will become your colleagues for the rest of your life. And he was right, and I'm glad I followed his advice. One truism that I found in these 63 years since I started medical school has been that all of public health is actually global health, because every place in the world is both local and global. But a second truism is that no matter what our actual job, we all share an objective of 3 words: global health equity. If you take any of those 3 words away, you have taken something away. But you could add 200 words and not improve that. So global health equity. A third truism came to me when I was talking years ago to the state health officers, and at the question and answer period, one of them asked me, what's your understanding of the difference in philosophy between medicine and public health? And I said, my understanding was that the philosophy behind science is to reduce the walls of ignorance, to find truth, to seek truth. The philosophy behind medicine was to use that truth for every patient. But the philosophy behind public health was to use that truth for everyone. Therefore, the real philosophy behind public health turns out to be social justice. A fourth truism that came to me over a period of time, and that is that a foundation for any of our work really involves 3 different things, 3 different legs. The first one is, of course, science, that we're all so accustomed to just assuming, yes, science is the basis of what we are doing. And it is. But science is not truth. Science is a way of trying to get close to truth. And Richard Feynman said that certainty is the Achilles heel of science. He said, you simply can't be certain of things. You come as close to certainty as you can. And he used the example of when he was shaving one day, and it suddenly dawned on him that the explanation physicists had always given for why left and right were reversed in the mirror could not possibly be true, or top and bottom would also be reversed. And it set him on a whole new look of trying to figure out what's the truth when you look into a mirror. So we start with science, and we say we come as close as we can to certainty, but we never quite make it. But then Will Durant said there's something in science, and that's when you add art to science, because art represents creativity. Huxley described science as being common sense at its best. But when you add art, you have creative common sense at its best. And yet there's a third leg. And this comes to us from Roger Bacon 700 years ago, when he was asked to do a report on science for the Pope. And he was so enthusiastic about science and actually predicted cars and airplanes and submarines 700 years ago. But he said to the Pope, science has no moral compass. If you add that as the third leg, then you have creative, moral common sense at its best. And this is not a bad foundation for what you're doing and what you will do in the future. Coalitions. None of us can do anything alone. It's probably always been true, but it certainly is true now. None of us can do anything alone. And Gandhi once said that we should seek interdependence with the same zeal that we seek independence. And then he added, because there is no alternative. So the difference between a usual coalition and a great coalition comes down to how it operates. And most coalitions form because people have a similar interest, they have a similar religion, they have gone to the same college, they are the same nationality. But the very best coalitions are built around starting with what's the last mile? What's success for this coalition? And if you can define that last mile, then you can step back and figure out what's the next step towards getting to that last mile. The best coalitions also have figured out how to find creative substitutes for ego and turf guarding, because these are the things that destroy coalitions so quickly. But what are the rewards that come up for a team accomplishment rather than an individual accomplishment? And neglected diseases no longer have the same concern that they once did when you started. Because in the last 100 years, there's been so much attention given to the obvious problems. So we've looked at smallpox and polio and measles and cholera, and we've looked at meningitis and malaria, and people have done things, but it's only the last few decades that people have looked at the neglected diseases, and that now makes that so visible, and you've been part of making that happen. Operational research. When I first started at CDC, I was surprised by how much research was going on at CDC. And I met with Don Frederickson, who was the head of NIH. And I said to him, Congress sees NIH as the research arm of the Public Health Service, and they see CDC as the delivery arm. And I said, when I look at NIH, I find that you're actually doing a lot of applications, that you have programs in applying the science. I look at CDC and I see that we're doing a lot of research. What should we do to make it clear to Congress that we want to continue doing this, even if they see us as being research versus delivery. And Don said, at NIH, the best researchers are the ones who see their research being applied, because ultimately this is the power of science, application, not just the accumulation of knowledge, but application of that knowledge. And I said it was the same thing at CDC. The best appliers were the ones that were always asking, how can I improve on what we're doing? And so we concluded that research and application is something that we should try to get everyone to think about, no matter which agency they were in. And this is important for what you're doing also. Everyone should see themselves as a researcher and an applier simultaneously. Breaking down silence is a continuous problem. And example, one of the great lessons I learned in smallpox is that the best policies are based on the best science, but the best results are based on the best management. And so it's this combination of bringing specialists together, but then finally coming up with managers who deliver all of that to give the ultimate power to science. Which brings us to another subject, integration for impact. I like zealots who concentrate on a particular thing, but we then need generalists who integrate this with other things in order to apply them. E.O. Wilson has said that the integrators and the generalists will be the people sought after in the future. He said there will always be plenty of specialists, but we need the integrators. It's not just about careers. I recommend to students that they try to become generalists and specialists simultaneously. Generalists to learn as much about how the world operates as they can possibly learn. Be curious about just everything. And then specialists in order to have a skill that they can apply to improve what they're finding about the world. Integration, it becomes then a personal philosophy or approach, and combining vaccines is an example of integration. That's why we have DTP vaccine, MMR vaccine. But then you take another step and ask, if we're going to give those vaccines, how can we make sure that every contact with a child does more than just give one vaccine or even 8 vaccines, but does something more? It provides vitamins, checking growth charts, making sense for well child clinics and so forth. As we've looked back at the years since we started smallpox eradication and the 75 years since we've had WHO and CDC, there are lessons that are learned. And what bothers me is while we should be learning those lessons, we don't always learn them. What are some of the best lessons? Well, this is a cause and effect world. Nothing happens by chance. This is what Stephen Hawking said in his book, A Short History of Time. He said that the history of science is the gradual realization that things do not happen in an arbitrary fashion. It's a cause and effect world, not a magical world. And I think of smallpox when we started out, how many people saw smallpox as a not understandable disease. So there were deities that developed in India and in Africa to try to explain why people were getting smallpox. A second lesson is you have to know the truth. You can't change things unless you know the truth. And we've seen with the coronavirus pandemic, in this country, we simply don't know the truth, that we are not allowed to have the truth. And so the White House has changed what they've said day after day. They give mixed messages, and it's been very difficult to know the truth. The way you get the truth is a surveillance system that develops the right denominators and numerators so you can interpret what's happened. We've learned the need for coalitions, which I've already mentioned, but we've learned also you have to have national plans. During this pandemic, we have 50 states trying to develop their own plans. It's not only inefficient, but it causes rivalries, it causes competition in trying to get supplies. We are very much in need of a national plan. We have to have global plans and then national plans. Then I go back to the best decisions are based on the best science, but the best results on the best management. And we do not have the best management. We've also learned that you have to work globally. President Trump has just violated every lesson that we've learned in the last 75 years on how to control a disease, pandemic, or outbreak. And he has somehow tarnished the reputation of the EPA, the FDA, CDC, FBI, CIA, DOJ, everything that he's touched. And we have to stand up now for the science. And let's use this pandemic to strengthen public health, to build foundations for the future, to integrate global health efforts, to improve the chances that we take a global approach to everything, that we never let this happen to us again, and to remember the words of Albert Einstein when he said, nationalism is an infantile disease. He said, it's the measles of mankind. Thank you.